Good morning. Well, while many of us are devouring heart-shaped chocolate today, one thing you'll need to start worrying about may be your own heart. It's known heart disease kills 1 in 3 women each year, which is approximately 1 woman every minute. But it doesn't affect all women alike, and the warning signs for women are a lot different than they are for men. What's more, these facts only begin to scratch the surface. So here to discuss more on what women need to know is Dr. Shadi Daoud, cardiologist with Healthcare Partners. How are you doing? Good morning.
Good morning. Happy Valentine's Day to you.
Happy Valentine's Day to you. Yes, definitely. And this is perfect to talk about as we're worrying about our hearts and our loved ones. We really need to worry about what's inside, especially women. Why is this such a big deal for women now?
So actually it's a big deal for women and men as well. We know it's #1 killer. As you said, every minute almost 1 woman dies because of the risk factors. I mean, almost 1 out of 2 Americans have a risk factor. We're talking about high blood pressure, talking about cholesterol and smoking. And unless we really bring those risk factors under control, we're going to continue to have this as a major issue. So women in specific, because most people have that idea that it's a men's disease, so it's not a woman's problem. However, women are as much to have maybe different symptoms, so they are more likely to have, most people are used to the idea of have a pain in the chest area. So women are more likely to have atypical symptoms in the arm, in the jaw, in the throat. Sometimes, and actually the fact is that almost 2/3 of women have the symptoms or present with sudden death without any prior symptoms. And that's the sad part, is not always we have a chance to act. Many times by time the symptoms are there, it's too late. So I think it all starts with prevention and taking care of your heart.
Yeah, let's talk about some of these easy preventative measures that people can take. It's as easy as maybe eating healthier or obviously doing more things.
So eating healthier, definitely. The thing is, most of the factors I mentioned, hypertension or high blood pressure, cholesterol, and smoking, you have to do something about it. So unless you know that you have high blood pressure, unless you monitor your numbers. So I'm focusing about blood pressure because I think it's the single most important risk factors contributing to heart disease in this country, in men and women, because almost, as I mentioned, as a risk factor, if you don't know your number, if you don't have a blood pressure machine at home, you're not going to know that you have blood pressure. So if we're going to wait till the signs and symptoms of heart attack and heart disease, many times it's too late. So prevention is #1 is exercise. So the American Heart Association recommends 30 minutes of daily moderate exercise or 5 days a week. Eating healthy, focusing on more fruits, more vegetables, less sodium, less packaged, less processed foods. Simple things you can change on your day-to-day routine. That goes long ways. Same thing about smoking. I see a lot of patients who think, oh, doctor, I smoked for 50 years and it's too late. It's never too late. The moment you stop smoking, you are reducing your risk by 1/3 right there, immediately. And your body starts healing up. So those are easy things. You cannot control your genes, your risk factors, but you can control your lifestyle.
Definitely. And so is chocolate okay? Some of these heart-healthy foods. Dark chocolate okay for us today?
Yes, especially today. Because actually the recent studies have shown dark chocolate has flavonoids in it and is protective. It has antioxidants that can fight all those bad metabolic side effects from cholesterol. So dark chocolate is, again, in moderation, because you still want to, like, look good and you don't want to gain weight. So yes.
Don't eat the whole box, ladies, just eat some. Well, to learn more and help raise awareness on heart disease, the Go Red for Women luncheon will actually be held on February 25th at the Aria Resort and Casino. For more info, just visit heart.org. Thank you so much for coming in. Really good to know. Stay with us here on Good Morning Las Vegas.